Health Principle, that's sleep, exercise, love, food. This is our weekly session that I hold where I try to go over the latest and greatest research that's coming out, mostly so that you get to hear what the research is, what it means, and more importantly, how you can directly start to apply it to your life. Now, keep in mind, this is completely separate from my day to day work that I do, and this is part of the nonprofit work that I do. So, with that, let's dive into today's topic, which I actually thought was fascinating and quite interesting. And that is, in the past, we have talked about in chronic kidney disease, how, especially in the advanced stages of chronic kidney disease, it becomes really important to follow a predominantly plant based diet, number one, and number two, to follow a low protein diet, specifically about zero point 0.6 or zero point 0.6 to zero point 0.8 grams per kilogram per day. And the concept there that we've talked about repeatedly is the idea that we're trying to slow down the progression of disease. And specifically, when we've talked about things like plant proteins, the reason we've been talking about plant proteins is because the data shows that they have less stress on whatever kidney cells you might have left. They also end up reducing the pressure on the kidney. So we call that hyperfiltration. They help to reduce that. Plant proteins have also been able to reduce the amount of protein that you're spilling. And more importantly, we have seen in several studies that they help to reduce the rate at which your kidneys are going down. Okay, so knowing all of that and knowing that on this channel specifically, we've talked over and over again on a low protein, predominantly plant based diet, what the heck am I doing talking about this latest study that came out, which says that a higher protein intake is actually protective in chronic kidney disease? So, in other words, according to the study, having more protein is better. So before you get all confused and start to say, oh my God, this is so crazy that it doesn't make any sense, let's take a look at the study. Let's understand what the study is actually trying to say. And then you can decide on your own what that means for your particular life. So starting with the basics, remember, if you are a healthy adult, general recommendations as people get older is about 1 gram to 1.2 grams per kilogram per day. This is the recommendation. Doesn't mean that it applies to you or it doesn't apply to you. And then for those who end up having chronic kidney disease, it's generally recommended not to go above 1.3 grams per kilogram per day if you have just stage 1, stage 2. And of course, if you have advanced kidney disease, stage 3 to 5, the recommendation there is not to exceed zero point 0.6 to zero point 0.8. So that's the general statement. So now, what is this study? What did the study show? And what should you know? So the study, by the way, this study is, I'll make sure you guys have the reference, Network Open, and the author is Carballo Casla. And so you'll have the link so you guys can see all of this, so you have that information. But this study has about 8,500 adults. Now, the key thing here is these adults are over the age of 60. And the study is looking at what is their protein intake, what's their chronic kidney status, and how does it compare to their risk of death. The 3 cohorts that they looked at are the study on cardiovascular health. They took the people from there. There's nutrition and frailty in older adults in Spain, study number 1, and study number 2. And then there's the Swedish national study on aging. So those are the 3 cohorts or groups that they took these patients out of. To Karen's question, we're going to get into if the study is talking about plant, animals, or it doesn't matter in terms of protein type in 1 second. Now, in terms of the patient follow-up, so patients were followed from 2021 to 2024. They analyzed the data in 2023 and 2024, and they started with 8,500 people. In the follow-up, 1,400 people died. So if you think about people over the age of 60, 1,400 out of 8,500 people dying is still a significant amount. And what they wanted to see was what was really the risk of dying overall. And so, in this population that they were studying, this is the most important part to understand, is that when they were looking at the sample, 4,700 people out of the 8,500 had chronic kidney disease. But the majority of them were either stage 1, stage 2, or stage 3. So stage 1 was about 1% of the group. Stage 2 was about 15% of the group. Stage 3A was about 69% of the group. And stage 3B were 14%. But here is the most important part. The most important part is that patients who had advanced CKD, stages 4 and stages 5, were excluded. They did not have those patients in the study. And they did not have patients on dialysis in this study. So once again, this is only a study of older adults, specifically age 60 and older. Number 2, this is a study that did not look at patients on dialysis or stages 4 and 5. Very important points to remember as we get into the findings of the study. So, what did the study find? Remember, this is a population study. This is not a randomized control study. You really can't do randomized control studies. So, what they found was that in these adults, ages greater than 60 years old, if they took in higher total protein, they saw that there was a significant reduction in their risk of death over 10 years. So, specifically, if they were getting protein intakes of 1 gram per kilogram, they had a 12% reduction. If they got 1.2 grams per kilogram, they had a 21% reduction. If they got 1.4 grams per kilogram per day of protein, they got a 27% reduction. And if they got 1.6 grams per kilogram per day, they had a 33% reduction. This is compared to essentially the control of 0.8 grams per kilogram per day. So far, what you're seeing is that more protein, and the higher you go, the better it was for these older adults with stages 1 through 3. In fact, if you start to look at it a different way, for every 0.2 grams per kilogram per day that they increased in total protein, they saw about an 8% lower risk of dying in the chronic kidney disease group, and they saw a 15% lower risk of dying in patients who did not have any kidney disease. And then if you start to look at adults over the age of 75, so remember the study was 60 and above. Now they're breaking that down and specifically looking at patients who are 75 and above. So those who were 75 and above, what they saw was that if they went ahead and increased their protein by 0.2 kilograms per day, they saw a 9% lower risk of all-cause death. But here's the kicker. Those that were younger than 75, they did not see a statistically significant survival advantage if they increased their protein. Now, I know some of you are listening to this and you're saying, oh man, now I'm completely confused on this protein opinion. Should I be increasing protein? Should I not? So let's break this down a little bit so you can understand the key take-home points of this study and what it means to you. So a couple of things. First is, the study is trying to show that as we get older, specifically above the age of 60, more importantly, above the age of 75, in those populations, in stages 1 through 3 and in the regular population, increasing protein may actually be important in terms of your overall health, not kidneys, but overall health. What we know about protein is that higher protein can increase muscle mass and strength, can reduce the rate of bone loss. There can be higher bone density in patients who end up consuming more protein. There's a lower risk of falling, breaking a hip, fracture, so forth. Even things like recovering from any illnesses. It's better if you have more protein in you. So here's the challenge. The challenge is so far we've talked about low protein diets. So what does this study add? And why is it so confusing? First, the idea of a low protein plant based diet is not changed in stages 4, stages 5, or in dialysis patients. Number two is if you are somebody who has significant protein in the urine and are younger, we still recommend a low protein diet. The only population that needs to understand this study is patients who are older, 60 and above, more importantly, 75 and above. In those patients, increasing protein, as long as you don't have advanced kidney disease, it actually helps overall survival. It's not having anything to do specifically with kidney decline, it's your overall survival. In fact, there's something known as an obesity paradox. If you've listened to me long enough on this channel, you've probably heard me talk about this. Obesity paradox is where somebody who's elderly loses weight and their risk of death goes up. It's when a cancer patient loses weight, their risk of death goes up. Or in dialysis, when dialysis patients lose weight, their risk of death comes up. And in those previous studies, the question was, well, what is it that's causing them to have this paradoxical increase in death? And it was because they had lower muscle mass. So having more muscle, not weight, but lean body mass, is protective. And as we get older, it matters more. So, this is why when we talk about even weight loss drugs, you'll hear me talk about drugs like Ozempic, or we call them GLPs or GLP-1s. What I say is because the data shows that the weight you lose, 30 to 50% of that weight can be muscle. These drugs in patients who are older can actually be very detrimental to long-term outcomes. The sort of tongue-in-cheek joke that I always say is you don't want to be the best looking person in the coffin. You're trying to be healthy and live your life better. And because of that, you want to understand these nuances. So as you're listening to this today or whenever you're listening to this, don't get confused by the headlines. In chronic kidney disease, if you are younger, if you have significant disease, stages 4 or 5, dialysis, stages 4 or 5, we still recommend higher protein intake. On dialysis, because of what we talked about with obesity paradox, you have to increase the protein intake. If you're older, specifically 75 and above, or even 60 and above, please increase the protein in your diet and hit the gym. Do resistance training 3 times a week. If you're a man, if you're a woman, it does not matter. You have to lift weights. Lifting weights is one of the most important things you can go ahead and do. All right, so with that, let's turn to the questions. Hopefully, this study is helpful in terms of you understanding. We'll look at all of the different areas. Let's start off on this side with the YouTube channel. It sees colchicine 0.5 milligrams is used as a cardiovascular anti-inflammatory. Is it used as a CKD anti-inflammatory at a lower dose? So for D. Dutton, the answer is right now, I'm not aware of nephrologists prescribing it for that purpose. I have run across a couple of studies that have talked about its anti-inflammatory role. It does apply to the kidneys as well as the heart. So the answer is yes on that. But colchicine is not a benign drug, so it's not being promoted as such. Karen says, is the study talking about plant proteins? So what was interesting in this study was that higher protein intakes, regardless of whether it was plant or animal based, either way, they still had the same protective benefit in patients who were older, specifically over the age of 60. Let's see, on Instagram, there was a question. In your opinion, can the increased use of protein supplements through lifespan affect kidney function? So, whenever you have a choice, it's always better to eat your protein than to drink your protein. If you're somebody who's elderly or who has, GI issues or so forth, then you should drink it. But if you can, eating your protein is always better. Protein supplements are great when you just can't get enough protein. Otherwise, you really want to rely on food sources. But we know that, especially in patients on dialysis, it's very hard for them to get enough protein. And that's where protein supplements become very important. So the answer is yes for protein supplements, but keep in mind, if you're taking in a lot of protein, but your body has no use for it, you're just going to filter it out. So if you don't want to just filter it out, you want it to be used, you have to do resistance training. Resistance training is going to be very important. Other questions I see, D. Dutton says he's already on whole food plant-based diet. Are keto analogs ever used with CKD4 with very low protein diet? They are used in studies. Remember the Japanese study used keto analogs in that particular case. Is it better than protein loading in this new study? The answer is nobody knows. It's a great question, but nobody can answer that question because we wouldn't be able to tell. This study is specifically a population-based study that's looking at follow-up to see, is there a correlation between increasing protein in patients above the age of 60 and the risk of death? Crafty yes, welcome again. Let's see, plant-based, i.e. lentils, natural milk, i.e. soy or nut milk, like in the biblical times, does work. So yeah, absolutely. Remember, plant-based foods overall, we have a lot of data on how they can improve and slow down the rate of decline of kidneys. And then Crafty S said, my granddad lived to 96 on a no meat diet. Proves to me this diet works. He died of natural old aging. Just remember, life is all about progress over perfection. Wherever you are, whoever you are, whatever you can do, start there. That's always the best place. And if you make small changes, good for you. If you can make bigger changes, great. But just don't get hung up on knowing or thinking you always have to be great or perfect to get results. Every small change matters. Beth said, what is the safest way to take colchicine for gout? And is it safer to take that with a flare-up or take allopurinol? So remember, allopurinol, we don't start allopurinol in an acute setting because it can make the gout attack worse. Allopurinol is done all the time. And so that's where you want to make sure that if you're given allopurinol by your doctor, that's more of a long-term thing, not for an acute flare-up. Acute flare-up, they'll give you colchicine, and there are certain other medications they can give. One question is, what are your thoughts on creatine for kidneys? So remember, when you take creatine, your blood test will look worse. That doesn't mean that creatine is damaging your kidneys. It just means the blood test looks worse. So that's part one. Part two is creatine has a number of benefits. Most people use it because it can improve muscle mass if you're lifting. So in other words, if you, let's say, bench press and you get 5 reps, it will help you get the 6th rep. That's what it does. So nothing miraculous. It will get you a little bit more benefit out of it. On the other side, creatine has a number of brain health benefits. That's why I take it myself. And I find that portion of it is very fascinating. Michelle said, if you had an episode of proteinuria and are between 2 and are over 60 years in plant-based, would an increase help me? So if I understand this correctly, Michelle, you're saying that you have protein in the urine. If it's one episode, well, that doesn't, you have to put that aside and figure out what caused it. A urinary tract infection can cause an acute episode of protein in the urine, sometimes with blood as well. So put that aside. But let's say you have chronic protein in the urine and you're over the age of 60 and your kidney function is a stage 2. So if you're over the age of 60 and you look at this latest study that just came out, what this is saying is that you don't want to be overly restricted. You want to increase your protein. Along with what I'm saying is that along with having more protein, you also want to make sure that you're doing resistance training. So remember, resistance training should be combined with any increase in protein. Otherwise, excess protein is just going to get filtered out. All right, I think that is the last of the questions. Let's see. Nope, there's a couple more. Let's see. Akazi said, would you recommend keto analogs to improve EGFR? The answer is no. Keto analogs will not improve your kidney function. Keto analogs were a method of getting the amino acids in so you didn't have to increase all of the proteins that you needed. And then another question was, does protein increase the pH of urine? No, it actually decreases the pH of urine. So it will decrease. In other words, you're going to make the urine more acidic if you're increasing protein in your diet. And then Michelle clarified that it was 2 and stage 3A. Yeah, so same thing. If you're talking about 3A, it's the same thing. Lynn said that someone told me to drink soda water or bicarbonate of soda in water to reverse my CKD. So, Lynn, that is not correct. The idea of bicarbonate is to move towards more alkaline type diet. If you go towards alkaline type diet, what you're going to find is it's essentially eating more fruits and vegetables. So more of a plant-based diet is the alkaline diet. It will slow down the rate of kidney function decline. But be careful when people start to say words like, I will reverse your disease, I will cure your disease. That's where you always have to ask the question is do they know? And do they have something to gain? Or, it's just one of those things. There's a difference between hope versus hype. This channel, I've always tried to give people hope and present data, but not go and say those kind of terms that are more hype, because everyone deserves better. They want to know the truth about this stuff. All right, let's look at some other questions. Let's see. Robin said, my nephrologist said a new study shows that GLP slow down the kidney, so creatinine goes up, but may not mean damaging. So no, that is not correct. So GLP-1s or GLP-1s like Ozempic, Wegovy, etc., they can slow down the rate of decline. They can reduce the protein you're spilling in the urine. So both of those things can happen. But because they can also cause fluid shifting, for example, nausea, vomiting, diarrhea, that can be quite severe. That can cause acute kidney injury. So if you've been prescribed one of these drugs and you're having diarrhea or you're throwing up and you can't keep food down, it becomes very important to talk to your doctor and get your blood test done, because that can result in damage. So the idea that the numbers change but kidneys are not going worse, that's where what we call an acute kidney injury. The numbers went up because there's an acute injury, but the kidney then recovered and healed itself. So keep that in mind as you're thinking about that. Somebody asked the question, RP Floor said, the pH of urine has to be always neutral. No, it doesn't have to be neutral. But what the pH of the urine tells you is it's a good way of looking at the quality of your diet will affect what's happening in the urine, so you can look at it. And then, so makes them lazy, so not clearing as much, but not necessarily damaging them. Robin asked the question. So no, when you're taking GLP-1s, they're not doing anything to the clearance. Everything that goes through your kidneys is how much pressure, which is the fluid coming in, gets cleared and goes out from the tubules, the nephrons do their job. It goes out, ends up in the bladder, and comes out as urine. So what happens is if you reduce the blood flow to the kidneys start to starve. And when they start to starve, they start to clamp down. And that makes the blood test numbers look worse, because things like creatinine start to build up inside the blood. So all that's happening is if you have fluid loss, you can see acute kidney injury. Just like if your blood pressure gets too low, you reduce the blood flow to the kidneys. So keep that in mind that it's fluid shifting. And if you're having side effects, you always want to make sure that you're talking to your doctor, because with these GLP-1s, there's a lot of people who just say, oh, these are great. But we've talked about it several times that there's a very strong dark side that you want to understand, both short term and long term. All right, coming back to questions over here, Yamato asked the question, what is the difference in protein blood test and urine test? Totally different story. Remember, in urine, you should have very little protein. So the normal range for protein in the urine is very low. But what happens is when you start to look at specifically urine, you see a lot of protein. That means the barrier to the kidney is broken or leaky. And as a result, protein that should be held onto your body is spilling out. And so in your body, when we measure your protein, if you're somebody who's spilling a ton of protein in the urine, your blood protein level will also go down. So the answer is you will see both of those things dropping. Let's see. Barbara asked a question. Great information. Thank you so much. Are you still doing takes with Michelle? Absolutely. Michelle's my partner in crime. We also have a dual live episode that we always do. So you guys are welcome to come to that as well. Let's see. Amanda said, do you lean towards prescription or natural cures? No, you always start with trying to take care of sleep, exercise, love, and food. Those are the foundation of everything. And if that's not enough, then you go to the next level. And the next level is medications if needed. So the answer is if you don't have the foundation, right, it's like building a house. If you want to build a house, you got to get the foundation in the right place. And that's why we always start with this concept of self. Self, as I stated, is the nonprofit that I have. And I started it because of the fact that there is so much misinformation on the internet. Everybody's an expert. And yet, my job is to not be the expert, to just present you the studies, give you the reference, explain what the studies are about, and then you can go ahead and do your own thing. Now, let's see. Our Flora said, what is the ideal number for pH of the urine? We're going to go into all the urine specifics for you, so you'll have all those details. So don't worry about that. You will see the range if you get a urine test. Once again, if it's overly aggressive, then we want to make sure that if it's too low, we want to understand, is your diet too acidic? Is it very heavy in meats and so forth? If the urine pH is too high, we want to understand that is there something going on where you're starting to build up too much alkaline inside your body. Oftentimes, if your lungs have too much acid buildup, your body responds by trying to build base. And so what can cause too much acid to build up? Well, if you have sleep apnea and you can't breathe well, so you're starting to retain carbon dioxide, that will go ahead and do it. All right, let's look at a couple of more questions. Maria said, what is the biggest cause of calcium kidney stones, in your opinion? I'm a heavy stone producer, and it seems like no one can tell me why. I have many stones in both kidneys. So, Maria, remember, it depends on if it's calcium oxalate, which is the most common type of kidney stones, or if it's calcium phosphate. And what happens is when you have calcium oxalate stones, it's because of the fact that when you eat, there isn't enough calcium to bind to the oxalate. So the oxalate gets absorbed very quickly, goes into your kidneys, binds to calcium in your kidneys, and now you got a wonderful calcium oxalate stone. And the treatment for calcium oxalate stones, just like for every stone, the number one treatment is you have to work on drinking a lot of water. How much water? Enough to make 2 liters of urine each day. That becomes very important. 2 liters of urine each day. So in order to make that 2 liters on a hot day, you might be drinking 3 liters of water. And then we start to check other things. We want to check a urine kidney stone panel. We want to see how much citrate is in there to prevent stone formation. We want to see, are you eating too much salt in your diet? And that can drive kidney stones. There are so many things that we have to check when it comes to kidney stones, so it matters. Let's say another person asked the question, Does sleep apnea have anything to do with kidney disease? The answer is absolutely yes. Sleep apnea can lead to CO2 or carbon dioxide inside your lungs, which is acid. As a result, your body will try to hold on to base or alkaline. So you will see your urine pH may be a little bit higher. So, in other words, sleep apnea affects the quality of your life because if you don't get quality sleep, your cravings for bad food go up, not to mention that you're having periods of low oxygen inside your body. That's bad for your brain health. And of course, it's bad for every part of your body. All right, the time is now 5:30. Remember, we have these every Wednesday from 5 p.m. to 5:30 p.m. Pacific Central Time. 5:30, I go run over to my girls' wrestling. I'm doing jiu-jitsu now. As you can see, I broke my finger again. It's a terrible thing, but I always give the same message over and over again. And this is the same message I give my daughters. As you know, they're 7 and 11. And the message always is the same, which is if you can grow up to be anything in this world, why not grow up to be kind? So remember, at the end of the day, nobody will care how smart you are. Nobody will care how much money you have. We're all going to die the same way. And so the idea is people will always remember how you made them feel. And so, all of our differences, whether you agree with me or not, my hope is that I make you feel that you are valuable, that you're respected, and I treat all of you with kindness. That's always been my purpose in my life. I hope you understand that, and I hope you share that with everybody else. If you like these episodes, I would greatly appreciate it if you pass the word along every Wednesday, 5 p.m. to 5:30. YouTube, Instagram, we're there. And thanks so much again. Much gratitude for you guys.